Dr. Bertagnolli received a degree in biochemical engineering from Princeton University and an MD from the University of Utah. She then trained in surgery at Brigham and Women's Hospital in Boston and completed a 3-year research fellowship in tumor immunology at the Dana-Farber Cancer Institute. After completing her residency, she joined the faculty at Cornell Medical Center and there directed the Strang-Cornell Hereditary Colon Cancer Program. Her background in immunology research was applied to study the relationship between inflammation and tumor formation. Her team was the first to show in an animal model that non-steroidal anti-inflammatory drugs blocked tumor formation by inhibiting a specific tissue enzyme, cyclooxygenase 2. To investigate the clinical relevance of these results, she led a multinational trial showing that a selective COX inhibitor, Celoxib, prevented tumors in patients at risk for colon cancer. This study also found increased cardiovascular disease among Celoxib users, raising a concern for routine use of these drugs for both cancer prevention and arthritis. Ongoing laboratory work examines the relationship between target tissue prostaglandin activity, tumor progression, cancer genomics, and response to NSAIDs. Beginning in 1994, Dr. Bertagnolli was one of the organizing members correlative science initiatives within the National Cancer Institute-funded cancer cooperative groups. Through leadership roles in Cancer and Leukemia Group B, she facilitated integration of molecular markers of treatment outcome into nationwide clinical cancer treatment protocols. In 2008, she was elected to serve as chair of the Cancer and Leukemia Group B. In 2011, as part of a National Cancer Institute program reorganization, she assumed leadership of the Alliance for Clinical Trials in Oncology, a new cancer clinical trials research group formed by the merger of Cancer and Leukemia Group B, the North Central Cancer Treatment Group, and the American College of Surgeons Oncology Group. She is also the founding president and CEO of Alliance Foundation Trials, LLC, a non-for-profit corporation that conducts international cancer clinical trials. Known collectively as the Alliance, these multinational initiatives support more than 1,100 institutions and 12,000 investigators and maintain a roster of from 60 to 85 active clinical trials in all cancer types. Dr. Bertagnolli's clinical focus is the treatment of patients with complex gastrointestinal tumors and sarcomas. Since returning to Boston in 2000, she has been a member of the Dana-Farber Brigham and Women's Cancer Center Gastrointestinal Cancer and Sarcoma Disease Centers, where she collaborates with colleagues in medical oncology, radiation oncology, and pathology to treat cancer patients in a tertiary care setting. In 2007, she became the Chief of Surgical Oncology at Dana-Farber Brigham and Women's Cancer Center, and in 2008 she became the first woman at Brigham and Women's Hospital to achieve the rank of Professor of Surgery, Harvard Medical School. She currently holds the Richard E. Wilson, M.D. Endowed Chair in the field of surgical oncology at Harvard Medical School. She also serves on the Harvard Medical School Faculty Council, an advisory body charged with representing the faculty and assisting the dean in formulating policies for the School of Medicine. Her national advisory roles currently include membership in the Foundation for the National Institute Health Biomarkers Consortium and the U.S. Institute of Medicine's National Cancer Policy Forum. Dr. Bertagnolli lives in Boston with her husband, Alexander Danenberg, Ph.D., and their two sons, Benjamin and David.